Ready?
تمام.
Good morning, everyone. Today we want to discuss the local pelvic examination. Before we are doing local pelvic examination, we should know that we ask the patient to evacuate her bladder. Also, you should respect the confidentiality and the dignity of the patient. Ask the patient to undress and sit in the examination table in lithotomy position or modified lithotomy position. Of course, you should take verbal consent before doing local pelvic examination. So, what are the items of local pelvic examination? We have inspection, then speculum examination, then BV and the bimanual examination, then combined BV and rectal examination, and in some circumstances we need BR examination as a single item, and I will tell you the indications. Before you are doing examination, you should wear highly disinfected gloves, okay? And we'll start with the inspection. Of course, before starting examination of the external genitalia, you should do abdominal examination. And you should examine the groin and the inguinal ligaments and the inguinal lymph nodes palpating. Then you shift to the external genitalia. First, we want to know what is the external genitalia. I have here the mons and iris. Here is the clitoris. This is the glands of the clitoris, and this is the prepuce of the clitoris. This is the labia majora on both sides. This is the labia minora, and this is the fourchette. And here is the perineum, and here is the external anal sphincter with the corrugation around. Okay, this is the external genitalia. Labia majora is the outmost, and it is sac, and they contain fat, and is hairy. While labia minora is thin, delicate, without any hair. Okay. Inspection for the external genitalia for any ulcer, any tumor, any discharge, any bleeding coming from the vaginal introitus or discharge. Okay? So, all the inspection for any lesions in this area. Okay. Then you separate both labia like that to see any discharge or any mass bulging like cystocele, rectocele, or uterine descent. Also, for any discharge, mucoburial or offensive discharge or whatever, and you should know the character of this discharge. Then, you ask the patient to strain or cuff. Why the patient strain or cuff? Because I wanted to see if there is any stress incontinence or not. So, if the patient cough and there is a spurt of urine, this is called positive stress test for incontinence. Then, you see the perineum. Is it short perineum? Is it defective perineum? Is there an old perineal tear or not? And the perineum usually 3 centimeters or more. So, if there is less than 3 centimeters, it's called defective perineum. Corrugation around the external sphincter, indicating that this sphincter is healthy. Okay? Okay. Also, by inspection, I can see a mass like porcelain cyst. You will see it forming the S-shaped introitus because the swelling will partially obstruct the introitus. It is called S-shaped due to porcelain cyst on either side of the labia majora will be embedded here. Okay? Okay. And if you find any discharge coming from porcelain, you should take a swab from this part. Okay. This is as regard the inspection. Then we will shift to speculum examination. How to hold speculum? Speculum, we hold it like that, between index and middle finger. Okay? Speculum is formed of 2 plates, screw, and handle. This is called casque speculum. I have different sizes of casque speculum, at least 3 or 4 speculum. So I should use the size of the speculum suitable for this lady. Okay? Sometimes I need the smallest one, sometimes I need the largest one, and so on. Okay? So what about this speculum? This speculum, I hold it like that. Then I want to insert it inside the vagina. I will insert it edgewise in this direction, so not to cause discomfort to the patient. Okay, how I'm going to do? Like this. I'll separate both labia first by my left hand, while by my right hand I insert it in the direction of the vagina like this, till half of the blade is inside. Then I rotate it 90 degrees, like that. Okay? So I insert it wide longitudinal and edgewise, so not to cause discomfort of the patient. Of course, the diameter of the speculum is smaller when it is in longitudinal direction. Then half of the blade inside, I rotate it 90 degrees. Then I'll complete the insertion like that. Then I'll open the blades. My target is to see the external os and the portion of the cervix. Okay? Okay. Then I'll fix the screw. I'll fix the screw now. This is a self-returning speculum. I don't need a system. Okay? I can see now the portion very well. Okay. If I found infection, I need to take a swab. So I have a cotton tip swab here. This is a sterile one. Sorry. This is a sterile one. I'll insert it in the external os to take the swab. Okay? Rotate it 360 degrees. Then get it out without touching anything. Then apply it to the tube. Then send that for examination in the lab. Okay? This is called swab for infection. Is there any place I can take a swab from? Yes, I can take high vaginal swab from the posterior fornix. I'll insert another one. Suppose this is another swab. I insert it in the posterior fornix. Where is the posterior fornix? If we consider this is the cervix, this is the uterus, here is the anterior fornix, here is the posterior fornix, here is the lateral fornix. So I take it from this side. I rotate this swab 360 degrees. Then I get it out. Then I insert it inside the tube, so I can send to the lab two swabs. One from the external os and one from the posterior fornix, what's called high vaginal swab. Okay, suppose I saw while I'm examining the lady cervical erosion or ectomy or suspicious cervix. Cervical erosion is a wrong name, as we know. It is called ectomy or ectropium. This is the right name. If I see something suspicious in the cervix, or if I'm doing a screening program for ladies in my country, so I wanna to use this cytobrush. This cytobrush for smear. So how I do cervical smear? I insert the brush here, then rotate it 360 degrees like that. Okay? Then I take the brush and spread it on this slide like that. So everyone should do it like me. You have the model and you have a speculum. Please do it as I do right now. I spread it like that. Then I spray fixator on the slide, then keep it in a box and send it to be tested in the lab for baptism. Okay? Another way is to put the cytobrush inside the saline, inside the bottle, like that. Then close the bottle, then send it to the lab. So either you do it on a slide, spread it on a slide, or you insert it. So I can use two also smear from the cervix for cytological evaluation. One on a slide, fix it by spray, and another one
in a saline bottle and sent to the lab. Also, I told you for infection, I can have 2 swabs for infection. One from the external os and one from the posterior fornix, or what's called the high vision swab. Okay. So, I did it right now. I can do any procedure while I'm inserting the speculum inside. If I'm planning for ID insertion, I'm ready right now to hold the cervix with the volcellum, multiple toothed one. I'll hold the anterior lip like that. Then I can measure the length of the uterine cavity using uterine sound first, and to know the direction of the uterus. If it is AVF like that or RVF, then I insert the ID, for example. So I can do many things while I'm holding the anterior lip and I'm inserting the speculum inside. Okay, let us continue our job. When I do speculum examination, my target is to see if there is vaginal mass or cervical mass or ulcer or polyp or discharge or inflammation or redness. Sometimes you see the cervix strawberry or flea red light, as in trichomonas vaginitis and cervicitis. So you will inspect the cervix and the vagina. Which part of the cervix is seen for you? The portion, this part. This part is seen while you are doing speculum examination. This part of the cervix. This is the external os. I can see if there is ectopy, redness around the external os. I can see if there is polyp coming from the external os. So speculum helped me to detect many lesions during examination. Okay? Okay. Also, it is important for different procedures, as we said before. For management, using speculum, also I can do ablation for the cervix, for cervical ectopy, okay, using speculum, cascospeculum, and then you will do ablation, either electroablation or cryoablation. So, speculum is helping you to deal with the portion of the cervix. Okay? Okay. I finished the examination, I see everything. Then I wanna to withdraw the speculum. How to get it out? On the reverse direction, all the steps on the reverse. First, I loose the screw like that. Then I close the plates with 2 fingers. Then I get it half of the blade out. Then rotate it 90 degree. 90 degree. You remember when we inserted? This is in the reverse direction. Then the speculum becomes longitudinal. I get it out like that. Okay? So, again, I insert the speculum in longitudinal direction like that, edgewise. I separate the labia. I insert it like that till half of the blade. Then I rotate it right angle. Then I complete the insertion. Then I open the blade like that till I see the portion of the cervix. Then I hold the screw. Everyone should do it like what I'm doing right now. Okay? Then I examine this portion of the vagina for any lesions or discharge or bleeding or whatever. Then I'm doing any procedure I wanted to do, like swab for infection or using cytobrush for smear from the cervix for screening for CIN. Then I finished my job. I wanted to withdraw the speculum. I lose the screw first. I close the blades. Then little withdrawal outside till half of the blade. Then rotate right angle 90 degree. Then remove it like that. Why I don't insert it like that in the transverse direction like that? Because it may cause discomfort to the patient. Because the diameter here is little. Okay? So I insert it like that, then I rotate it. Okay. This is as regards Speculum Examination. Next step, I wanted to do BV and the Bimanual Examination. Why I need BV and the Bimanual Examination? BV, how to do it? By index and middle finger. Then I separate the labia by my left hand like that. Then I insert the two fingers inside the vagina like that. Try to feel the portion of the cervix and the vagina for any mass or ulcer. Okay? And you can ask the patient to hold herself to be sure that the tone of the elevator in eye is okay. Then, while you two finger inside, you are trying to feel the uterus and the adnexus. How? By my left hand on the abdomen in the suprapubic region, I'm trying to feel the uterus like that. What is my comment on the uterus as regard the size of the uterus, the shape of the uterus, the position of the uterus? Is it AVF or RVF? Any mass, and the consistency and the mobility from side to side. And if it is tender or not. This is my comment on the uterus. Then I'll go to the post-iliac region. I'll complete my bimanual examination. My finger inside in the lateral fornix here, I'm trying to feel the adnexus. The adnexus, including the ovaries, the tubes, and the broad ligament. If I felt any mass, I should explain more about the mass. What is the size? Is it tender or not? What is the consistency? Is it cystic or solid? Is it mobile or fixed? And so on. So, the aim of bimanual examination to examine the uterus as regards size, position, consistency, mobility, and tenderness, and the adnexus for the same if there is any mass or tenderness. Okay? Okay. This is the bimanual examination. Next step, you may need the combined BV and perirectal examination. How to do it? The middle finger will be in the rectum, and the index finger will be in the vagina, like that. Okay? So, this is the combined BV. Why I need combined BV? Why? Combined BV is important to detect if there is mass between the rectum and the vagina, if there is tenderness or pain in this area, as in cases of endometriosis in the rectovaginal space. Also, to diagnose anterior seal. Anterior seal is diagnosed also by combined BV and BR examination. So, BV and BR, combined BV and BR is needed in some cases. Let us shift to the next step in examination, which is BR examination. Is there need for BR examination? Yes. There is certain indication in which I need BR examination. Like what? Suppose I'm dealing with a virgin and I don't want to injure the hymen. So, how to do pelvic examination by manual examination while I'm not going to injure the hymen? So, I'll insert the index finger inside the rectum and my left hand on the abdomen and try to do the bimanual examination through BR. Second, it is important in case of cervical malignancy to test the parametrial infiltration. In case of cancer cervix, parametrial infiltration in both sides may occur, and it is best to be felt by BR examination. Okay? You can feel it, BR, while your hand on the lower abdomen trying to feel if there is extension of the cervical malignancy to both sides. Also, it is important in cases with rectal carcinoma. Also, it is important in cases with rectocele to diagnose rectocele and to differentiate rectocele from true rectocele from false rectocele. So, BR examination is important in certain circumstances. I need it. Also, I need it in case of mass in Douglas pouch. like pelvic abscess, okay, or nodular cervix due to endometriosis. So I need to do BR to feel the Douglas pouch more better than BV. Okay, so BR in certain circumstances is needed and sometimes done under anesthesia to be done very well. So now we finished the whole items. At the end, you should tell the patient about the positive finding after you finish the examination. This is very important. Then, remember, you are wearing highly disinfectant gloves and you can change it during the examination when you are going to do BV and BR. Remember to disinfect these gloves in chlorine 0.5% solution. Immerse your hands inside, then you remove the gloves like that, turn it from inside out like that. This is called turn it from inside out. Okay? And put it in a leak-proof container. This is very important to avoid transmission of infection and for infection control. Okay? So, this is the end of the local examination. Then help the patient to sit up in the bed. Okay? Then ask her to get her dressed. Then thank her for her cooperation. This is the end of local examination. Thank you.